Thank you very much for all the questions. And the questions reveal that this is a difficult area. Now, I think all that discussion illustrates the fundamental problem, is that whether there is bias depends on whether is related to whether missingness in the outcome depends on its true value. That's what the graphs that Julian showed were trying to illustrate. But we can't examine that directly because, as I said in answer to a question, we don't know the missing values, so we can't directly see whether missingness in the outcome depends on its true value. But we can infer that that is likely, or that missingness may depend on the true value in three ways listed on this slide. So the first bit of evidence that missingness in the outcome depends on its true value is when the proportion of missing data in one group differs from the proportion of missing data in the other group. The second bit of evidence that missingness in the outcome depends on its true value is when trial authors report reasons for missing outcome data. For example, if missingness in one group is related to withdrawal from follow-up because of no symptoms, whereas missingness in the other group is due to adverse effects, then that provides evidence that missingness in the outcome depends on its true value. So, sorry, that's really the third example. The second reason is that if we report reasons for missing outcome data, and the reason for missing outcome data is related to the true value. For example, I was feeling really, really sick, or I was too sick to continue follow-up in the trial. That provides evidence that missingness in the outcome depends on its true value. Next slide, please, Julian. Okay. Now, Julian will return to that when we explain how to answer the signalling questions and how the answers to the signalling questions lead to risk of bias judgments for this domain. We're now going to cover two important areas related to how to deal with missing outcome data that often influence risk of bias judgments. And the first area that we're going to talk about is the use of single and multiple imputation approaches to deal with missing data. And remember that here, in the context of trials, we're really only discussing missingness in the outcome data. In trials, we usually don't need to control for confounding, so we're not worrying here about missing data in confounders, and we expect that there is no missing data in intervention group here. There's no, we know for 100% of participants the intervention group to which they were assigned. So in imputation, we replace the missing value by an imputed value, which really just means a guess of the value. And single imputation is where we do that just once. Commonly used single imputation approaches include last observation carried forward. I didn't measure the final value, but I measured the value at 6 months, so I use that value. Or baseline observation carried forward. I'm interested in a trial of a blood pressure lowering medication. I didn't measure blood pressure at follow-up, but I know blood pressure at baseline, so I'm going to use that. There's a simple message here, which is that each of these approaches is unlikely to remove the bias that occurs when missingness in the outcome depends on its true value, unless we make the very strong and often unjustified assumption that there's no change in the outcome after the last time it was measured. Additionally, the single imputation approaches improve precision artificially. we're pretending we know something that we do not know. Now, I'm sure that all of you, or most of you, know that these days multiple imputation is a commonly used approach to dealing with missing data. And the basis of multiple imputation is to replace missing values by multiple values in multiple data sets that are drawn at random from what's called a predictive distribution. So we predict the outcome, for example, based on things that we measured at baseline, and on the basis of predicting the outcome, we form multiple distinct filled-in data sets. Because these data sets, they do not have missing values, we filled them all in based on these predictive distributions. They can be analyzed using standard methods. And then results from the multiple data sets are analyzed, and then the results are combined to produce a single summary estimate and confidence interval that appropriately reflect the uncertainty associated with the missing data. So we don't have the problem, for multiple imputation, we don't have the problem of single imputation, that we're pretending we know things that in fact we do not know. There's a simple message here with regard to trials, that multiple imputation, unfortunately, will not remove or reduce the bias that occurs that when missingness in the outcome depends on its true value, unless this can be explained by measured variables, which in trials usually means variables that we measured at baseline. And a more technical way to say that is that multiple imputation does not reduce, or certainly does not remove, bias when outcome data are missing not at random, Rubin's terminology, MNAR. In fact, multiple imputation requires the assumption that missing data are missing at random in the terminology introduced by Rubin, which broadly speaking means that we could predict the missing values based on variables that we measured. In fact, imputing missing outcome data based only on the intervention group simply changes nothing. It will give results that are near identical to those to a complete case, from a complete case analysis. And if you think about it, it's obvious that it should do that. Otherwise, we could just plan to conduct a trial on 10,000 people, measure outcomes on 1,000 people, and impute the rest of them. And in fact, if we did that, we would simply get results that are the same as the results for the 1,000 people on whom we measured the outcomes. If the model we use for imputation is not correctly specified, multiple imputation will not remove bias, and it can even increase bias. Now, multiple imputation is an incredibly useful approach when we have missing values in lots of different variables, as often is the case in longitudinal cohort studies. It's just that it's not likely to be of use to remove bias due to missing outcome data in randomized trials. So when trial authors report an analysis based on multiple imputation, the estimates should be considered as at low risk of bias only if there's justification for assuming that missingness in the outcome does not depend on its true value other than through measured values included in the imputation model. And we think that's going to be the case quite rarely. One exception is that it may be possible to reduce bias associated with missing outcome data for trials in which values of the outcome are measured repeatedly over time, patients drop out during the trial, and the measurements of the outcome before dropout are used to predict the outcome that we would have seen had the patient not dropped out. But even when that approach is used, we need to consider carefully whether loss to follow-up might be related to the outcome trajectory after the last recorded measurement. So we see a trajectory of outcome measurements. then the patient drops out, but it's still possible that they dropped out because their outcome level had got a lot worse after the last recorded measurement. So the simple message there is that we should usually not assume that just because the trial authors reported an analysis based on multiple imputation, that has reduced the risk of bias. A good approach to thinking about bias due to missing outcome data is to conduct sensitivity analyses. And in sensitivity analyses, we make assumptions about the relationship between missingness in the outcome and its true value, and then we look at how the results change based on those assumptions. Sensitivity analyses may be reported by the trial authors, and often should be, but they can also be done, but even if the trial authors didn't conduct sensitivity analyses, they could be conducted by review authors to assist with risk of bias assessments. And in fact, one excellent use of multiple imputation is to adapt it to conduct sensitivity analyses. So we make an assumption about the relationship between missingness in the outcome and its true value. We incorporate that assumption in our imputation model. We then use imputed outcomes based on our assumption about the relationship between missingness in the outcome and its true value. We adjust our results based on that assumption. So, what's the relationship between doing sensitivity and analyses and risk of bias? Well, in assessing risk of bias, based on sensitivity analyses either conducted by trial authors or that we conducted, that the review authors conducted, we needed to consider whether the assumptions made in the sensitivity analyses are plausible. This is usually important than the particular method that was used to conduct the sensitivity analysis. So broadly speaking, we're saying, well, if we think that the range of assumptions reflects how realistically, how strongly missingness in the outcome could be related to its true value, and then if the sensitivity analyses demonstrate that trial results are not much altered by plausible assumptions about the missing data, then the risk of bias will be low. This relates to the discussion earlier in the webinar, where we talked about the proportion of missing outcome data. So if the proportion of missing outcome data were only 5%, you might need a much stronger relationship between missingness in the outcome and its true value to make an important change in the estimated effect of intervention than is the case if half of the outcomes are missing. Next, please.
Jonathan, I've just noticed a question that I don't know whether many people are struggling with this, but it's such an important point that we might just address it. Someone asked, well, he doesn't quite seem to feel comfortable with the notion of true outcome depending on the true, missing data depending on the true outcome, which is such a fundamental notion, and asked for some examples. So perhaps we just throw out some examples of situations where missingness depends on the true outcome.
Okay, challenging, but let's think about it.
One example is trials of smoking cessation, where people who drop out of the trial are often believed to be people who continue to smoke. And here the outcome is stop smoking or not. And those who do stop smoking tend to stay in the trial and be observed. Those who don't stop smoking are more likely to drop out. And so there, the dropout or the missingness is depending on whether or not you stop smoking.
Okay, and I'll go back to a mental health example. So we're conducting a trial of an intervention to improve mental health. Our outcome data is depression measured using the Beck inventory. And participants who become more seriously depressed are less likely to attend for their follow-up visit, at which depression is measured, so missingness depends on the true value. Or patient symptoms are so severe that they are too sick to attend follow-up. An opposite example, I guess, that could apply in depression or smoking is I'm feeling completely better, so I'm not interested in this intervention anymore, so I'm not going to come to any more follow-ups. Okay. So I hope that some of those examples help.
And there are some situations where outcome will not depend on its true value. For example, you know, if one of the centres of a multi-centre trial, all the records get destroyed in a fire, there'll be a lot of missing data, but they're not going to be, they're very unlikely to depend on the true values of those outcomes because it's a totally unrelated event.
Or to use another extreme example, I randomized 10,000 participants, and at random I select 1,000 participants to be followed up. Now that would be a stupid waste of effort, but there would be no bias when I followed up 1,000 participants because because the participants are selected at random for follow-up, so missingness in the outcome, the missing values in the 9,000 will not differ systematically from the measured values in the 1,000.
Yeah. And one last example: natural attrition due to people moving away from the study area. Typically, will not be related to their outcome.
Yeah, Amanda, thank you. In weight loss trials, it might be reasonable to assume that some participants are missing due to not losing weight, so they don't want to come back and have their weight measured. And Jaime Del Rio, what percentage of missing values invalidate a study? This is a big distinction between the way that the risk of bias tool assesses the risk of bias compared to what used to be done. There is no percentage. That's the problem. Because it depends, as Julian said at the beginning, on the nature of the outcome variable, on the risk of the outcome, and it also depends on, but fundamentally, the risk of bias depends on whether missingness in the outcome depends on its true value. So in the rather silly example I gave you, 90% of the outcome data were missing, but there was no bias because they'd been selected completely at random.
Should move on, Jonathan.
So when assessing, well, I think, Lorna, hopefully your question will be asked when we show you the questions on risk of bias assessment. So yes, we'll move on. So I just want to say something about time to event data, and this relates to some of the points that were made right at the beginning of the trial. Those of you who are keeping up with the COVID-19 literature may recognize these Kaplan-Meier plots that are taken from the recovery trial that showed that dexamethasone reduces mortality in hospitalized patients with COVID-19. And these are examples of time to event data, because for each patient, we've looked at whether they died or not, or whether they died or not within 28 days of follow-up, and we've also looked at time during which they were followed up. Okay, so next slide, please. So the important point is that for time to event data, the outcome is a combination of the length of time for which the participants followed, and then a dichotomous variable, for example, dead or alive, that indicates whether the outcome event was observed for each participant. And follow-up times for participants in whom the outcome event was not observed before observation stopped are said to be censored. Next, please. So results of in time to event analysis, it's often not obvious what missing data means, because for every participant, we either observe the event or they're censored. But there is a corresponding concept for when results of time to event analyses are not biased, and that's if censoring is what's called non-informative. That means that censoring times are unrelated to the subsequent times at which outcome events occur. For example, some of those patients in the recovery trial may only have been followed for 14 days when they closed the database and did their analysis. But if they were censored at 14 days, simply because that was the length of time for which they'd been followed up when the event occurred, then censoring can be assumed to be non-informative. Now, what happens if there is informative censoring? In that case, we will get bias if the chance that follow-up is censored depends on intervention group. For example, censoring might be more likely because participants in the experimental intervention group are lost to follow-up because of severe side effects, and the effect of the experimental and comparator interventions on the outcome differs. And this is all closely related to the concept of missingness in the outcome being related to its true value that we discussed earlier on. And similarly to what we discussed earlier on, either differences in rates of censoring between the intervention and control groups or differing reasons for censoring between the groups may provide evidence that censoring was informative. And that means that we conclude that there's bias due to missing outcome data in the same way as discussed earlier on. Now, right at the beginning, somebody talked about missing outcome data because of a protocol deviation. And this is an issue that we've come across when we've been working on systematic reviews that assess the risk of bias due to missing outcome data and using time to event analysis. So if there's a protocol deviation, what we would like the trial authors to do is to carry on following the participant and measure the outcome at the end of follow-up. That's the right thing to do, and if you then do an intention to treat analysis, there may well be no bias in the intention to treat effect. For example, a participant stops adhering to intervention, they've deviated from the trial protocol, you just follow them up, you measure the outcome, and you conduct an intention to treat analysis. So sometimes, and we've seen this, for example, in cancer trials, participants who deviate from the protocol are then censored by the authors. They stop follow-up at the protocol deviation. Well, that should not have been done, and participants who are censored during trial follow-up because of protocol deviations should be regarded as having missing outcome data. And you have to be very careful about this and look in the text of the trial report, or perhaps in the method section, because consort flow diagrams may show such participants as included in the analysis, because some of their follow-up, the follow-up before the protocol deviation, was indeed included.